Hello, dear doctors, and welcome back to Conquer Pathology with Dr. P. Today, we are diving deep into our Robbins Chapter 14 RBC and bleeding disorders. First, let's lay down the master blueprint for this massive topic. This is a brief overview of what we are going to learn in this chapter today. Let's start with first slide. This is Act 1, the erythrocyte saga, which covers everything from production to intrinsic destruction. We break this down into three core parts. Part 1 focuses on the RBC factory and the iron famine. Here we will explore erythropoiesis and the RBC indices like MCV, MCH, and MCHC. We will also contrast microcytic crises, specifically looking at iron deficiency or IDA versus anemia of chronic disease or AOCD. Moving on to part 2, we tackle the DNA dilemma and the empty marrow. This section includes macrocytic fails like the megaloblastic anemias stemming from B12 and folate tissues. We will also cover marrow failures like aplastic anemia and pure red cell aplasia, as well as conditions of overproduction like polycythemia vera. Finally, part 3 introduces the hemolytic hunger games, specifically focusing on the intrinsic side. Here we will decode membrane defects like hereditary spherocytosis and PNH, hemoglobinopathies including sickle cell anemia and thalassemia, and enzyme deficiencies like G6PD deficiency. Moving on to our next slide, we enter Act 2. Extrinsic warfare, platelet panic, and coagulation catastrophes. We pick up right where we left off with part 4, the hemolytic hunger games, but this time shifting to the extrinsic side coupled with platelet panic. Here we will examine immunohemolytic anemias, comparing warm IgG versus cold IgM AIHA. We will also dive into microangiopathic hemolytic anemias or MAHA and break down the platelet triad consisting of ITP, TTP, and HUS. Then we reach the grand finale in part 5, the clotting catastrophes. We will be demystifying the coagulation cascade, looking at the convergence of the intrinsic and extrinsic pathways at factor 10. We will cover factor deficiencies like hemophilia A and B and platelet factor defects like von Willebrand disease. Finally, we will cover the ultimate crash, disseminated intravascular coagulation or DIC. This is our roadmap for conquering chapter 14. Let's get started.